Alopecia is a common presentation in dermatology. There are many causes to hair loss. History taking can be very helpful in making the right diagnosis. The acronym for history taking alopecia is 5S's. First is sites. The scalp can be divided into different regions. From front to back, we have frontal scalp, mid-scalp, vertex scalp, and occipital scalp. On the sides, we have temples and parietal scalp. Certain dermatologic conditions happen in certain places of the scalp. For example, patient presenting with frontal and temporal alopecia, you can think of male pattern hair loss and traction alopecia. For vertex hair loss, it can happen in androgenic alopecia, but also classically in central centrifugal cicatricial alopecia. Second is speed. You want to ask the patient how is the time interval they notice significant changes in their hair. Did it look different 1 month ago or 6 months ago? For example, androgenic hair loss is slow and gradual, but conditions like anagen effluvian and alopecia areata, patient can have more rapid hair loss. Third S is shedding. It may be hard to quantify the shedding. One thing you can do is to use the visual shedding scale by showing the patient different pictures with different amount of hair. Then patient can pick the photograph that best correlates with the amount of daily hair shedding in a setting of daily washing. If the patient complains a lot of shedding, it is not typical for androgenic alopecia. You need to think of other causes. Next is symptoms. One big differentiation of hair loss is scarring versus non-scarring alopecia. It can help you narrow down the differential diagnosis. So it is important to ask about symptoms. You can ask patient about itch, pain, discharge, for example. Symptomatic alopecia points more towards scarring alopecia. Last but not least, supplements and medication, which are common cause of telogen effluvium. You want to focus on new medication that started 3 months before the start of alopecia. While numerous medications have been associated with hair loss, common ones include discontinuation of OCP, retinoids, anticoagulants, especially heparin, antithyroid medications, anticonvulsants, interferons, and beta blocker. Next time, when you see a patient complaining about hair loss, remember to ask about the 5S's. Thank you for listening.